Hello, my name is Carol Howell and I'm with UC Davis Center for Healthy Aging, and it is my pleasure to introduce Dr. Laura Mosqueda. She is the Chief of Geriatrics at UC Irvine School of Medicine, and she's a professor of family medicine and holds the Ronald W. Reagan Endowed Chair in Geriatrics. She sees patients at the UC Irvine Senior Health Center and participates in research and education as well. And her topic today is on elder abuse.
Thanks, Carol. It's a pleasure to be here to talk to you about this important topic of elder abuse. It's going to be a challenging topic, though. This is something that we don't talk about very often, and I think we really need to start challenging everybody in our society to think about this issue of elder abuse and understand it a little bit more. It's challenging in a number of different ways. I want people to imagine what it's like in terms of what elder abuse really is, to really ponder what it means to people, to take it beyond just the fact that, oh, that's a real shame that this occurs in our society, but to understand it as the trauma it really is to the people who are directly affected by it and everybody who loves them. I want you to acknowledge that this really exists, and I'm going to prove it to you as we talk today. And I want you to believe two things. I want you to believe that anyone can be a victim and anyone can be a perpetrator. And this, I think, is particularly challenging for us to really understand and take in. Well, what do we mean when we talk about elder abuse? There are a variety of categories of elder abuse as defined in state law in California, and I have them listed here on the screen: physical, sexual, financial abuse, neglect by other people towards somebody, neglecting yourself, issues of abandonment and abduction where people are actually taken across state lines, and psychological abuse. All of these types of abuse that I've just mentioned are reportable abuse. In other words, we are required, many of us, to report these to the state if we have a suspicion, although psychological abuse or emotional abuse is an optional report. We're going to focus in on the topic of physical abuse, neglect, and some issues related to sexual abuse as well. I'm going to go through a few examples, and unfortunately I have to tell you that these examples are based on real cases that I have been involved in. Here's an example of financial abuse. A 55-year-old woman who threatens her mother: if you don't sign on the dotted line to pay for my car, you're going to go into a nursing home. Another example, a 30-year-old man who befriends a widow. She's lonely, she's depressed, she lost her husband less than a year ago. And what people who are sort of predators will often do is find a hole, a gap, an emotional need somebody has, and fill that. And what does he do? He obtains the password for her ATM card and offers to help her buy groceries. And then he also helps himself to cash so that he has some for his own spending, to the tune of tens of thousands of dollars over a period of a year. Examples of physical abuse: pulling somebody's hair, in fact, dragging somebody by their hair across a carpet, throwing food or objects at somebody, denying access to pain medication, slapping, hitting, punching. A recent case I'm involved in involves a 16-year-old girl who was punching her grandmother in the face. These are the sad realities of what's going on. One of the more hidden types of abuse that I'd like to bring to your attention has to do with neglect. And before I give you some examples of neglect, I think it deserves a little bit of an explanation. When we talk about neglect, we're talking about a relationship, somebody who has assumed responsibility or care and custody for another individual who's unable to care for themselves. And when this person who has assumed this responsibility does not provide appropriate care, such as basics, food, clothing, and shelter, medical care, making sure the person's hygiene is reasonably taken care of, looking after things like health and safety hazards, when these things are not attended to in a reasonable way, we call this neglect. Here are some of the examples that I've seen. People who are lying in urine and feces, and I don't just mean a dirty diaper for a few minutes here or there. I mean people who are lying in their own urine and feces for hours, days, weeks at a time. People who have very elongated, filthy nails, matted hair, living in filthy conditions. People who are not fed or given fluids and they become malnourished and dehydrated. It's not good enough for somebody who's unable to get around to just leave some food at the bedside if they can't reach for it and feed themselves. People who develop deep open wounds that we call pressure sores, sometimes all the way down to their bones, because no one has repositioned them and they're unable to move on their own. These are some examples of neglect that we see. Well, how common is this problem of elder abuse? It's a great question, but it's a very hard one to answer. As you can imagine, it's hard to just knock on somebody's door and say, is anybody abusing grandma? So the question then becomes, how do we figure out how common a problem it is? We also need to understand that there are some difficulties in establishing abuse related to people's reluctance to even admit it's occurring. Not only can we not knock on the door to ask if anybody's abusing grandma, but grandma might not want to tell us if there's abuse going on. She might be ashamed that her own grandson is doing this to her. Many older adults fear losing their independence and in fact would rather remain at home in an abusive situation than go to a facility such as a nursing home. Again, a very sad reality. And unlike children, older adults can just sort of fade quietly away in our society and nobody thinks about it, nobody questions it. With kids, if they don't show up at school, we wonder what has happened to them. But we're very accepting of older adults sort of disappearing, oh, they got sick and you never see them again. So it's hard to know really what's going on sometimes. People who are being abused might be so incapacitated physically, cognitively, emotionally, that they're unable to even report that they're being abused. So people might be too incapacitated to report, but the other thing that sometimes occurs is that signs of abuse may be missed or mistaken for usual aging. After all, it's pretty common to have bruises as we get older. It's not uncommon to have a hip fracture, and so it can be really difficult to tell whether or not some of these injuries were a result of abuse or just something that happened by mistake. So I'm going to give you our best guess or guesstimate in terms of how common abuse is, but we also want to recognize that it probably is an underestimate. The best study we have so far is called the National Elder Abuse Incidence Study, published 10 years ago now, 1998, where there was some attempt to quantify the problem. And this is what they found, is that in a one-year period, there were 236,000 reports of seniors abused at home and 50,000 reports of abuse in nursing homes. I want you to really pay attention to this because one of the common myths is that abuse occurs in nursing homes and it's really not an issue in society, when the reality is that the vast majority of abuse occurs in private homes and the most common perpetrator is a family member. What did they learn? Well, not only do you have 236,000 reports of abuse in the community, 50,000 in nursing homes, but for every report of abuse, at least 5, some people think maybe triple that, go unreported. So when you look at the numbers, you're talking about at least 1 million older adults in 1998 victims of abuse. This is a big problem. So what happens now when we start projecting out in terms of numbers of older adults who live in the United States? And let's take a look at a graph for just a moment to examine this issue. You can see that the number of people over the age of 65, of course, is rising at a very, very rapid rate. One of the wonderful things now is that our life expectancies have gone up in a very dramatic fashion in just the past 100 years. But pay attention in particular to this red line, people who are 85 and over. They are the most rapidly growing segment of our society in the United States. Their numbers of people over the age of 85 are growing at an exponential rate. Look at the way the number takes off after the year 2030, and that's not very far off. Why do we have a special category for elders? In California, the law is that after the age of 65 is when we call something elder abuse. Does that mean it's okay to abuse somebody when they're 64 and then on their birthday at 65 it becomes criminal? Well, the reason we really talk about this special category for elders is that as we grow older, we do become more vulnerable to mistreatment. And so it just becomes a practical matter to have kind of an age cutoff for it, which I think is a reasonable way to go. What are some of these vulnerabilities? Well, as we grow older, it might be harder to defend ourselves from being abused. It might be harder to defend yourself from somebody coming at you with a blow. So it might be harder physically to defend yourself. And certainly emotionally, it might be harder to defend yourself against some of the verbal attacks that can be landed at you. You also may more dependent on others than you have in the past. We're all used to and enjoy being fairly independent creatures. And now if we begin to have some difficulty and we need help with very personal things like dressing, like grooming, like hygiene, all of a sudden there are more people involved in your life, more hands touching you, and again, vulnerabilities increase. There's also this fear that we talked about a few minutes ago, fear of losing your independence if a report is made. So now somebody might really be able to threaten you, sign over the house or I won't let you live in your own home anymore to help you stay in your own home. You'll have to go into a nursing home. Older adults are very susceptible to these sorts of threats, and that's quite easy to imagine. I want to spend just a moment talking to you about dementia as a special issue. I certainly have observed time and time again that people with dementia are particularly vulnerable to elder abuse. Alzheimer's disease, of course, is the most common type of dementia, and we need to recall that dementia is not just memory loss, but loss of other cognitive functions, so that people with a dementia certainly have short-term memory loss, but also have problems with things like judgment, reasoning, insight, language, difficulty comprehending things. And so you can imagine as people go through different stages of dementia, their risk of abuse also can be quite high. So in the early stages, when you're having memory trouble and difficulty comprehending things, people might have you sign on the dotted line and you might lose thousands of dollars, you might lose your house, other sorts of financial abuse that occurs. As people then move through the different stages of dementia and in the very end stage be very dependent, they may end up suffering from some very severe neglect. Dementia gets much more common as we grow older. So if you look at everybody over the age of 65, about 3 to 5% of people have a dementing illness. But past the age of 85, you're probably dealing with close to half of our population with dementia. And remember back to that slide we looked at a moment ago in terms of the growth of people over the age of 65, the growth of the number of people over the age of 85 in our society. People who have dementia may be unable to report abuse. You may no longer be able to use a telephone or know how to make a report. One thing that really scares me is we tend to really discount people who have dementing illnesses like Alzheimer's disease. So if a report is made, they're not believed. After all, they have a dementia, we really can't believe anything they say, and they get discounted. And people, particularly in the middle and later stages, may be unable to even recognize that they're being abused because they have such severe cognitive difficulties, they don't even comprehend the bad situation that they're in. Well, why is this happening? Why does elder abuse occur? And we don't really know the answer to this question, but I want to throw out a few possibilities for us to think about, and perhaps you can argue about them with some folks later on. Is it a mental illness problem? Or is it a caregiver who has, say, a bipolar disorder, or has schizophrenia, or has some other sort of mental health problem that makes them unable to properly care for a loved one? Is it that we just live in a violent society, that now pushing and shoving and hitting people has become more commonplace, and this is now translating into older adults as well? Is it a sense of entitlement? I'm going to get that money anyway, I may as well get it sooner than later. Is it stress? Boy, I'm trying to take care of the kids, my husband wants dinner as soon as he gets home, and now I'm taking care of his mother, my mother-in-law, and I just can't handle all this, and she keeps asking me the same question over and over again, and finally I just can't take it, so I just feel stressed. Or is that an excuse? Is it, as many people in the domestic violence community talk to us, really an issue of power and control? And we certainly see domestic violence in late life. Is it an issue of ageism? Do we just not care about what happens to older adults in our society? Do we just feel that, well, they're old anyway, so it doesn't matter as much? This scares me, but I've heard people speak like this. It's not as important if an older adult gets abused than if a child gets abused, because they're not going to live that much longer anyway. I think this is a horrible notion, and as a society we need to confront that many of us carry these beliefs deep within us. So some questions to ponder. What is our responsibility as family members? What is our responsibility as neighbors and friends? Are we ageist? Or do we have some concern about violating privacy? And we're always trying to balance these sorts of issues out. We don't want Big Brother watching after us. On the other hand, if we have a concern about a neighbor or a friend who we haven't seen, what is our responsibility to check in and make sure that they're okay, that they're not being isolated and kept in a back room, and that nobody's allowing phone calls to come in? I don't have answers. Right now I have questions that I'd like people to think about. What is our responsibility as a society? Are there laws that need to be enacted, or are there laws that are barriers right now to doing a good job in terms of care for older adults who are vulnerable? What role could the government play? What role should the government play? There's precious little funding right now that goes into research related to elder abuse, particularly when you compare the numbers of dollars that go into child abuse research, domestic violence research. Why is that? And who is the voice of these vulnerable elders to speak up to say, we need to do something more? What policies do we have in place right now that either allow or prevent elder abuse from occurring? So, for example, we have mandated reporting laws, and we now ask that the clergy make reports if they have a reasonable suspicion of elder abuse. Many of us fear making these sorts of reports. We fear that some sort of SWAT team is going to roll in and grab Granny out of the house, when in fact that's very far from the truth. What we have are agencies through the government called Adult Protective Services, who I think are some of the unsung heroes in our society, who will go to these homes, sometimes in dangerous situations, to check on an elder to see if they're okay. One thing I've learned is it's not my responsibility to confirm whether or not abuse has occurred. My responsibility as a healthcare provider and my responsibility as a citizen is simply to have a reasonable suspicion. If I have enough of a concern that abuse is occurring, I have a responsibility to report to Adult Protective Services to ask them to check on this person who we have some worries about. They'll then go to the home and hopefully try to make a face-to-face visit and establish whether or not there really is a problem going on. Why is this important? Why should you and the public really care about this issue? Remember this slide? Remember about the number of older adults who are growing in our society? Even if the percentage remains the same in terms of how common elder abuse is, the mere fact that we have growing numbers of people in our society means that this is going to be a growing problem, particularly because we don't yet understand enough about mechanisms to prevent abuse, which of course is our goal. So as the number of older adults in our society grows, and the number in particular of people over the age of 85, the most vulnerable members of our society, grows at an exponential rate, we have to care, and we have to really take more of an activist role in preventing and identifying and doing something when we think elder abuse has occurred. Someday this could be you. Any one of us can be a victim. Any one of us can be a perpetrator. We need to understand and believe these as truisms. I hope I've gotten you a little bit angry. I hope I've stimulated your interest so that you'll want to learn more about the issue of elder abuse. I hope that you'll want to get involved in either a small or a big way. A small way that you can get involved would be to just go and tell 5 people about what you've learned. Just tell 5 people that this is a problem, and you'll help us a great deal. You can also join an organization that we're starting called Elder Peace, which is really a grassroots advocacy organization. Because if you're 85 years old and you have Alzheimer's disease and you're being abused, you have no way to really go vote. You have no way to advocate for yourself. And we really need to help folks on their behalf so that this problem doesn't continue. I thank you for your attention.
Thank you, Dr. Mosqueda. May is Elder Abuse Prevention Month. So if you suspect verbal, physical, sexual, or financial abuse of a family member, neighbor, or friend who is an elder, please contact your local authorities or your local Adult Protective Services. They are there to help you. And keep an eye out for your elderly neighbor, your family member, and your friend. Take the time to stop and talk to them and listen. They have so much to share, and they have so many stories. You'd be surprised what you will learn. It's up to all of us to prevent elder abuse. So if you would like more information or need more resources, please contact the organizations listed at the end of this program. And for more programs sponsored by the Academic Geriatric Resource Program, located at the University of California Office of the President, please visit the website at www.ucop.edu/AGRP. Again, that's www.ucop.edu/AGRP. And also, please visit the UC Davis Center for Healthy Aging at healthyaging.ucdavis.edu. Thank you again for watching this important program.
So this does have an impact on, on Alzheimer's disease. It is a risk factor, and I emphasize this because sometimes people ask, well, so why don't I just go out and get a test for this? Because you can. It's a genetic test. It can be done. There's a couple reasons that we don't recommend it. First of all, as I say, it is a risk factor. So if you knew that you were carrying the E4 gene, you'd probably feel bad. And if you found out that you were not carrying it, you'd probably feel good. But you really shouldn't either way. And that is because there are certainly a lot of people who carry the E4 gene who never get Alzheimer's disease. And there's a lot of people, like 40% of the people who get Alzheimer's disease, who don't carry that gene. So it's a risk factor, and we can't translate that general risk into individual probabilities at this point. But again, this is something that has helped us understand a lot about what goes wrong in the brain with Alzheimer's disease. So, age tells a lot of the story. The genes tell part of the story, and as I think as we go on in the next 5-10 years, maybe even less, we're going to learn a lot more about the genetics of Alzheimer's disease. But I don't think it's going to be the sort of thing that just single genes cause the illness in the strong sense of the word. A lot of risk factors, I think, is what we're going to learn about in the next few years. Now, Alzheimer's disease turns out to be complicated, and there are other risk factors as well. And you can't do much about your age, and you can't do anything about your genes. There are things you can do things about. Let's talk about these. I call these secondary risk factors because they're not as strong as the first couple I talked about, but these do matter. So, head injury, low education, mental inactivity, a sedentary and a non-active lifestyle, and cerebrovascular disease or strokes. So let me talk about these a little bit, because all of these raise the risk of Alzheimer's disease. I use this picture partly because I like the picture, but this was the picture that the New York Times ran that accompanied the obituary for this man right here, who is Jerry Quarry. Jerry Quarry was a pro boxer who died in his early 50s after several years of a dementing illness. And most of you will know that Muhammad Ali also has a brain illness at this point. It's not Alzheimer's disease, but it has affected him greatly physically and mentally as well. And I'm baffled sometimes if people think that this is not bad for your brain. Don't do this. Don't get a head injury. It raises your risk of Alzheimer's disease. I think that's pretty self-evident.
Put this together and it means that people who have a dementia such as Alzheimer's disease are especially vulnerable to being abused. What are some clues that abuse may have occurred? Well, during your history and interview, you want to pay attention to some of these kinds of issues. Does the explanation make sense? Is it plausible that this has really occurred? Is it so vague that you can't even understand what they're telling you has occurred? Was there a delay in seeking care? So by the time somebody comes in to see you, they have a stage 4 pressure sore. We'll go over the stages of pressure sores in just a moment to remind you what they are, but that's a deep pressure sore. What was going on when it was a stage 1 or a stage 2 or stage 3? Why weren't they seeking care at an earlier time? Are there unexplained injuries that you find on exam? Maybe some of the injuries might be old, or they might be current injuries that were never reported. What does the interaction look like between the patient and the caregiver? Are they arguing? Do you notice that the patient is reacting in a fearful manner whenever the caregiver is around? Do you notice that the caregiver is yelling or belittling at the patient that you have who's right in front of you? Pay attention to this during an interview. What about clues on the physical exam? Are you finding open sores, bruises, other wounds that make you concerned? Does the person have an unkempt, sort of dirty appearance? Is their hygiene very poor? Whenever I have the least little bit concern, I always take off shoes and socks. Sometimes people will get a bit cleaned up to come into the office to see you, or if they know you're going to the home, but they usually don't think you're going to look at their feet. And sometimes you'll take off shoes and socks and find very elongated, dirty nails that will clue you in to the fact that there really is a problem. Look for evidence of malnutrition. Does it look like there's a lot of muscle wasting? Evidence of dehydration. Is their mouth really dry? Does it seem like they're very thirsty?